Cervical radicular pain. A lot of us have heard of this term called cervical radicular pain. Let's try to understand better what it exactly means. Many of the patients come to us suffering from neck pain, running all the way down towards the hand and the fingers. It's like a shooting kind of a pain. Many of you would have heard of the term called sciatica, that is the back pain, like an electric shock like going till the toes and the feet. Similarly, in the neck region also, the neck pain can sometimes go down till the fingers and the arm, resulting in a sharp shooting pain called cervical radicular pain. The first and most common cause is something called as a slip disc. This over here is a model of the backbone, and this blue region is called as the cervical spine. In between over here you can see this rubber kind of structures. These are called as discs. Whenever this disc slips out, it's called as a slip disc, and the slip disc can press on a spinal nerve, leading to cervical radicular pain. Other potential causes include something like an injury, a fall, a pull, infections, tumors, etc. People who are smokers, smoke a lot, their discs become weak and they are at a larger risk of developing cervical radicular pain. Other group of people are those who play a lot of golf, people who lift heavy items, and people who are swimmers who dive a lot are more prone to develop all this kind of problems. One very common symptom is tingling, numbness, going all the way from the neck to the arms and shoulder region, etc. They can present with pain also, which is sharp electric shock like running all the way to the fingers. Some patients can also develop weakness, inability to hold objects, and less power in their hands. Usually, whenever we suspect a cervical radicular pain in a patient, we ask the patient to get a few set of investigations done. Out of them, the most important is something called as an MRI. MRI will give an image of the entire cervical spine, the disc, and we can exactly know which spinal nerve is getting pinched or pressed. A multimodal, multidisciplinary approach is what is most important. First, we start off with the conservative management for people who come to us with cervical radicular pain of short duration. Conservative management includes medicines, wherein we prescribe certain painkillers and certain medications to numb the pain arising from a nerve. Physical therapy, rehabilitation, physiotherapy has its own equal importance. Strengthening of the neck muscles helps a lot in preventing all these kind of problems. For patients who are not responding to any of these treatments, we do the interventional cervical treatments. What comes under this interventional cervical treatments is something called as a cervical epidural intervention. What is the cervical epidural intervention? In the cervical epidural intervention, what we do is we use a sophisticated technique wherein a needle is taken and it is put close to your spine near a potential space called an epidural space. Now this space is actually in close proximity to your spinal cord. So it requires a lot of expertise, wherein we utilize an X-ray machine called as a fluoroscope to exactly locate the needle position, and then we are going to inject a medication to decrease the pain and inflammation arising out of all those structures. Well, to conclude, I would say if any of your near and dear ones are suffering from neck pain or neck pain which is going all the way down to the hands and arms, please contact us.